Wellness for Life is brought to you by Sanford Health Clinic and Same Day Surgery Center, Perham Area Community Center, Sally's Oils, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership.
Hello and welcome. I'm Sally Corbett of Sally's Oils, and today we're going to be talking a little bit about how we use the oils. We're going to start with aromatic. So first, let's grab a bottle of oil. Let's just open it, bring it up to your nose, and inhale. It's simple but very beneficial, so much so that I hope you do this every time. One example of this is with lemon oil. Inhalation alone is said to increase your memory recall by as much as 58%. Who doesn't need that? You could also put a drop or two of oil into the palm of your hand, rub your hands together, cup them, bring them up to your face, and breathe it in. I really like both of these methods for a simple, quick pick-me-up, emotional balancing, and even respiratory support. If you want to disperse the oils in the air, you can put them in a device such as this. This is called a diffuser. Now this is water-based. There are different kinds out there on the market. A couple things to remember. If you're new to the oils, just put a couple drops in there till your body gets used to it. Then after that, you can increase. Also, don't heat the oils as it destroys any therapeutic value. Some examples of some things I like to diffuse are cedar wood, lavender, and even peace and calming. They all help me relax and get a better night's sleep. Peppermint is a great choice for a pick-me-up, maybe a citrus oil mixed in there. My favorite oil this time of year is a blend oil that I have that's called Thieves. It's a combination of single oils. It's known to help kill those germs in the air and boost my immune system. Now, if you happen to come down with a little something this time of year, you can try what's called a steam inhalation. You need a steamy basin of water, oil, and a towel. So to do that, just put a couple drops of oil in that basin, put the towel over your head in the basin, and then just breathe that in. It's really great for us. We use a blend oil called RC, but find what works for you. Now you can also put these oils topically on your skin. Take a look at your bottle and see if you need to dilute it or not. If you need to dilute it, you're going to need what's called a carrier oil. A few examples of a carrier oil are an extra virgin olive oil, a coconut oil, or Young Living has what's called a V6 oil. So what you can do is you can put that essential oil directly on your skin, just like that, and then you can put the carrier oil on top of it, just to dilute it. Rub that in. Okay? You can also dilute it by putting it in a small dark glass bottle, and you can mix the essential oil and the carrier oil in there. Now, where are you going to put these oils on your body? And you can put them absolutely anywhere, because once you put them on your body, it's absorbed immediately and reaches every cell within about 21 minutes. Some common spots are, if you have head discomfort, you can put it on the temples or the back of your neck. If I have any abdominal problems, it's going right there on my tummy. And the bottom of your feet is a real common spot. As you have larger pores, it's absorbed even quicker, and also they're less sensitive. The bottom of your feet also have areas that are called Vitaflex points. Now those are points that just correlate with other areas on your body, so if you put oils on there, you can have added benefits. The oils go in quickly, but they leave your body quickly too. They're gone within 2 to 3 hours. That's all the time I have for today. Feel free to call me with any questions, and until next time, blessings and health.
Coming up on Wellness for Life.
I'm Dr. John Larson. I'm a family physician with the Sanford Health Clinic in Detroit Lakes, and we're going to talk about influenza today. Influenza is an infection caused by the influenza virus. There are numerous strains that occur throughout the world throughout the year, and the vaccine is based on the three most important viruses selected by the World Health Organization. Now this year, we're having a problem because there has been what they call a drift in the virus, one of the viruses that causes the infection. And so it's not completely effective, but it still is more than 50% effective in preventing those. And also because of the nature of the viruses, it will have some effect on any of the viruses that cause influenza should you contract those. The most common symptoms with influenza are fever and body aches. Other symptoms may include a runny nose, cough, sore throat, and very rarely nausea, vomiting, or diarrhea. And that's a common misconception. People think that when they have the flu shot, it will protect them against the stomach flu. But the actual flu shot is more aimed at the respiratory virus. The respiratory virus is more dangerous in people who are very old and who are very young. Those are where we see the most fatalities and the most hospitalizations. We do have medications that will help. There's a medication called Tamiflu that we can give within 24 to 48 hours that will shorten the course by a day or two and also limit the intensity of the symptoms. But the most important thing is to have your flu vaccination. Usually the flu vaccination is available in late September or early October. Other things that you can do are to make sure that you wash your hands frequently. The virus is spread by either physical contact with the virus or by inhaling the virus as it's spread by people coughing or sneezing. So if somebody coughs or sneezes and then touches another item, and then you come behind them and touch that item and then touch any of your mucous membranes, you're more likely to contract it. So it's very important to make sure that you keep surfaces clean and that you wash your hands frequently. You can also use hand sanitizers, which are also very effective. The best time to come in if you think you have the influenza virus is within 24 hours of the onset of the symptoms. That allows us to start the medication in a timely manner so that we can limit the length of the infection as well as the intensity. Influenza is much different from the stomach flu. The stomach flu usually is vomiting and diarrhea, whereas the influenza will have more of the upper respiratory and respiratory symptoms. The most important thing with having the stomach flu is to make sure that you stay well hydrated. So starting with small sips of water, whatever will stay down, and sort of gradually increasing your fluid intake until you're holding things down, and then you can gradually move on to a more bland diet. Things like bananas, rice, applesauce, dry toast, tea, Gatorade, Pedialyte, and those kind of things. We call it the brat diet. And just trying to make sure that you stay well hydrated until your body overcomes the virus. One of the more challenging things about the gastroenteritis or the stomach flu is that it seems to be lasting longer than it used to. A few years ago, it was usually no more than 24 hours in duration, and now sometimes it's going up to 5 and 6 days, which can be very difficult to manage and gives you a much greater chance of suffering from dehydration. Signs and symptoms of dehydration include dry mouth, cracked lips. In small children, you'll see their eyes will sink. If you pinch the skin will tint, and you can see that in just about any age group. Another thing that we'll do is the capillary refill, where you pinch the fingernail, and it will go white and then turn red again or pink. And if it takes more than 2 seconds for it to become pink, there's a greater risk of dehydration, and we should evaluate them. And always, if there are questions, we are happy to see you in the walk-in clinic or answer your calls or your MyChart messages.
Thank you for watching Wellness for Life, brought to you by Sanford Health Clinic and Same Day Surgery Center, Perham Area Community Center, Sally's Oils, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership,